This is part 3, the final episode of this mini-series with Bill. We've covered the past, now we're going to talk about the future and what this all means. And so something you mentioned there about how there's a lot of people struggling as much as we think we do. And I think that's something that echoes throughout the community where a lot of the times with congenital heart defects, you're either fine or you're not. Because when things come up, they're major and they need to be addressed, but they're addressed surgically and the rest is follow-up. And something I say to people that tell me they don't feel like they should talk about it because they are not struggling now or they're not struggling as much as others, someone maybe with mental health condition or drug dependency issue, a lot of pain, a lot of struggle, a lot of pressure, a lot of it is binary. It's a switch. Either you're struggling or you're not. So especially for these patients, if they say to me, this is very difficult, but it's harder for people that have a visible disability, I like to bring it back to a struggle is a struggle, and your brain's going to react to it whether it's the worst thing in the world or just slightly bad. Your cognitive perception of it will change significantly, and the way it hits you will change significantly, but the emotional aspect to it is going to be more or less a light switch. Now, I don't know if that's true 100% of the time, but I feel like it gives these patients a much better way to feel about themselves when they do hit that struggle, or when they do, they could be 20 years out from surgeries and probably won't need one for another 20 years and not feel entitled to that kind of support that the ACHA, the Adult Congenital Heart Association, other organizations offer. And that's when I like to tell them, well, just because you don't need everything right now doesn't mean you don't need something, some support, someone to talk to.
Well, I've been told ever since I had my surgery 73 years ago, I've been told by just about every doctor I've seen, Bill, at some point, you're probably going to need a valve replacement. Well, that was 73 years ago. It's kind of getting old with me now. Everybody tells me that. And I say, really? I said, I'm almost 77 years old and I haven't had a valve replacement. That's not to say I won't need one next year, of course. And if I do, you face it and you do it. But even though everybody who has CHD and has had open heart surgery feels there's something hanging over their head in the future that is going to be difficult to overcome, whether it's a valve replacement or another surgery or something, you can't let it bother you. You really can't. I mean, every time I see a doctor, they say you're going to need a valve replacement. I just don't let that bother me. If I do, I do. Okay. I don't sit and dwell about it. I don't worry about it. I've been there. I've done that. You just keep moving. But I understand that people react to all this. One of the things I've learned through ACHA is people react to all this very differently. And it's the people who do need help getting through this that we want to reach, not only in terms of mental health issues or dealing with family issues, but of course there's the other side of the coin, which is just access alone to care. And I've been fortunate to have had the resources all my life to have access to care, and it's probably kept me to get to 77. A lot of people don't have that ability or the availability to have access to care all the time. And that's one of the main things we're trying to do at ACHA is spread access, and access not just to cardiac care, but to adult cardiac care. And this is a whole different podcast. We can talk about what's the difference between the two, and there's a huge difference, as you know. But I mean, that's one of our missions at ACHA is to make sure that people like us have access to care to keep us going. And that's one of the reasons I'm involved.
Yeah, well said. And, we won't break into the nitty gritty of the difference in care, but let's just at a high level, I mean, you'll know more than I do, but at a high level, how would you say pediatric and adult care is different? And then I'm going to compare it to my experience,
How would I say that adult care is different?
adult congenital care.
Well, I mean, there are many answers to that. One is, of course, physiology. I mean, as we grow older, our heart and our heart structure and our system changes. And in some ways, it becomes much more complex than the pediatric heart. And that's why we've learned in the last, 10 years that we need cardiologists who are specially trained to deal with adult cardiac issues. Um, you know, I think it's like 8 or 9 out of 10 cardiologists in the country only know pediatric cardiology. And one of the reasons that there's that and it's sad, but that sharp transition between the teen years and early adult years is that when you get to your teen years and you're becoming an adult, pediatric cardiologists don't want to deal with you anymore because they don't know how to deal with you anymore. They're not trained to deal with, the adult heart. And you kind of feel like you're pushed aside. And it's our job, our meaning ACHA, it's our job to help those people find the cardiologists who specialize in adult care so they can continue to have the care that they need as they get older. And that's one of our major missions at ACHA. We're one of the few health organizations that exist where there's no cure for what we have. We've had it since we were born. It's in the name of our organization, congenital. A lot of other, organizations, whether it's cancer or, ALS or MS, whatever, those are all acquired, if I can use that word, acquired diseases and conditions. We don't have it. We've had it all our lives, and there's no cure for it. We just have to adapt to it and do the best we can with it. So that's what makes our organization a little different than everybody else. And when I go and I talk to people who want to know what ACHA does and why we're different from the American Heart Association or ALS or the Cancer Association, I say, we're one of the few organizations where we don't have a cure. Our problem is access. Our problem is developing with something we've all had all our lives. And that's not as easy as you think if you haven't had that problem. So, yeah, that's why I think ACHA is such a critical organization and why we've got to do everything we can to support it.
I'm right there with you. I'm happy you used the word acquired because not only is there a difference between pediatric congenital heart care and adult congenital heart care, but a lot of people see is the acquired cardiology care. And it's important to differentiate between congenital cardiology, which is for the malformations in the structure of the heart present at birth, which would be things like we have, pulmonary valve stenosis and what have you, versus acquired heart disease, which is an entirely different ballgame. It's changes to the heart from a normal baseline as you age, be it from age itself, be it from dieting or lack thereof, or just other age-related changes. What amazes me is I had pediatric cardiologists all through my life until I was 16 and had my last surgery. And after that last surgery, the doctor I probably had 12 cardiologists before the age of 18. And I said that once on a panel, and I had a room full of very unhappy doctors afterwards. I switched to an adult cardiologist. I didn't know anything about adult congenital. I was going to acquired heart disease specialist. And then I come to graduate school the first time at Vanderbilt. And it was right there in November 2020 where no matter what I did, I got COVID. And afterwards, my Vanderbilt school doctor said, "Hey, I want to get your heart checked just because we don't know how COVID affects it." So she sends me to a cardiologist, and the cardiologist says, "Why are you here? We have an entire adult congenital heart division." And I said, "What's that mean?" And boy, did that put me down a path. And the different, I mean, being able to speak to a cardiologist who not only understands the adult aspect, but was able to bring me into the loop, and at least, I didn't know what I didn't know. Just one conversation with him, I could at least know what to Google and go read. And I mean, ChatGPT would have been not released yet, but I can go ask 6 different large language models, "Hey, what does this mean? How do I understand it? Explain it to me as someone with limited medical knowledge." And the narrative completely shifts. But no, none of my adult acquired heart disease doctors were able to, mention that to me. None of them mentioned that I should be going to a congenital heart doctor, and none of them explained the difference
Right.
until I got out here. Until I was what, 22, 23.
Right. Well,
So
that's why it's so important that we have these clinics that we accredit around the country. I think we have
you knew
56
right
or
where I
50.
was going with it too. Yes.
Yeah. We have all these clinics. One of our best is at Vanderbilt. And we have at the Mayo, Hopkins, Stanford. We have them all over UCLA. We have them all over the country. But fortunately, these clinics now are being able to offer adult care to people who have grown up with a congenital heart problem and now are no longer should no longer be seen by a pediatric cardiologist. They should be seen by an adult congenital cardiologist. And fortunately, that universe is expanding, and in that respect, we're meeting our mission in that we're providing access to care, and hopefully, we'll continue to do that.
When did the term adult congenital heart care, adult congenital cardiology enter your world? Did you go to a pediatric cardiologist for most of your life, or was there a program for you in place?
Well, I went. No, I had a clear transition. My transition when I was about 20, when I started going to the Mayo, Dr. Warrens at the Mayo was an adult cardiologist, and she specialized. Not, I don't think she specialized, but she was aware of congenital adult cardiology. She was the one that she's one of the trailblazers of adult congenital cardiology, Dr. Warrens, and I think that's when I first became aware that there was a difference between a cardiologist seeing you as an adult and a cardiologist that was seeing you as a child. I don't think I connected in my mind the phrase adult congenital cardiology exactly at that time. It wasn't really until Dr. Warren said to me at some point, you ought to see a adult congenital cardiologist, and I have one in Washington you should see because I trained her. And that's when I really became aware of the difference. And it was Dr. John, as I said, that brought to my attention ACHA and said, you really should get involved in this organization, which I did.
So your first adult cardiologist, I mean, your care in that field really progressed as the field itself progressed.
Yes.
Let's be frank here. Before your generation, adult congenital heart patients just weren't making it to adult,
Right.
or conditions were
Right.
going undiagnosed, and
Exactly.
they
Right.
weren't.
I was probably a little bit ahead of the curve on that. I think when I first started going to the Mayo, adult congenital cardiology care was first coming into existence, and that's why I was very fortunate to be able to go to the Mayo, because I think I got very good care early on in what I needed as I transitioned from my teen years to my adult years. But yeah, and one of the big issues we face, in dealing with this whole question we're talking about is number one, convincing people with cardiac issues that as an adult they need to have special care, and secondly, providing them access to it. Because there are a lot of people around the country who have a congenital heart condition, and they don't know that there's a specialty for you as you become an adult. They think they can just go see their own pediatric cardiologist and they'll take care of them. Well, that doesn't work. And if you're told that, you shouldn't be told that because it doesn't work. So, we have a big mission and an important one. And, we've got, I think the latest number I saw was about 5 or 6 million people in the United States with a congenital heart condition. That's a big constituency.
And growing rapidly as,
Yep.
1 in 100 babies born today will have it. And as care has progressed, we're diagnosing it earlier, we're fixing it earlier, we're fixing, the killers earlier. And this universe is only going to keep growing. But what really gets me is it is the most common birth defect. But because of all the different defects out there and sets of defects, a lot of people don't realize there's an awareness issue. There's a major awareness issue for the condition overall. A quick sidebar, even people who know don't. When I organized the ACHA's Nashville Walk, the annual fundraising event, and I took it to I'm in the weekend MBA at Vanderbilt, and I took it to that cohort. And I had 2 gentlemen, actually, in the 50-person class, 2 guys came up to me and said, "Hey, I had this issue, or I had that issue when I was a kid, or I had open heart when I was a kid. Is that like a congenital heart defect?" I said, "Well, that is one. Have you followed up with a cardiologist?" Okay, so you remember when I said 75% of patients are lost to care, and that's who we're trying to reach? That's you. And what really, I've been dying to tell this story. About 2 weeks ago, I was talking to a mentor of mine who has helped me. He helped me prepare for my ACHA board interviews. He helped me market the walk. He's helped me with everything in my professional and personal career. And a lot of that is ACHA. He's also donated a ton of money as he's helped me. And he was talking, it's like, yeah. And when I was a kid, I had to go to a cardiologist for a while because my mitral valve didn't grow quick enough. And there was considerable regurgitation, but I grew out of it and blah, blah, blah. And I'm paraphrasing here because I was sitting there aghast because this guy who knew everything about congenital heart charities and everything that I've gone through didn't even realize he had a CHD. So as we're sitting there and fight, and he didn't. When I said that to him, he kind of looked at me. But it was a pretty big oh shit moment for the both of us. But it proved the point of fighting for the ACHA with the ACHA to get at patients access to adult care is a fight that is bigger than that because we're fighting for awareness of the congenital heart world in a lot of ways. So, and this isn't real. This is going to be just an open-ended question. This is going to be like, what do we do, Bill? How do we address this?
Well, it's a question I think about every day. I don't know. It is a tall mountain to climb. I think that I know I talk about the issue a lot more with people who even don't have a heart condition. Every time I get an opportunity to talk to a group or talk to people, or I'm at a dinner with friends, or I somehow try and get this issue on the table because maybe it's to the point where, oh God, cause he's coming to dinner, we got to think about something else to talk about. But awareness is the key. You're right. Awareness is the key word. I think what I've been thinking, you asked me the question, how do we deal with it? Let me give you my answer. I think if everybody who had CHD, like you and me and others, were to make a list of our 10 closest friends and say, look, you may or may not know about my story, but let me tell you my story and why it's important. And I would like you to help me. I would like to help me get the awareness out. If my 10 closest friends would somehow bring us to the attention of your 10 closest friends. Tell them to go to the ACHA website, take a look, see what we're about. I would think that would help spread the awareness. And I mean, that's basically what I try and do, is get my friends to think about it and talk about it. Fortunately, when we have our walk here in the Washington area every year, I get my friends here in the DC area to get involved, not only to just donate, but to actually come to the walk and meet some of us who've experienced, our CHD, have us talk about it, what the experience has been like, why it's so important, and why we need the assistance and the help and the money to get that awareness out. You're right. The key thing here is awareness. We're going to be able to find the places to have clinics. We're going to be able to do the research grants. But the thing that keeps our organization going and healthy is awareness. We've got to make people aware that we're not just people with a heart problem or condition. We're people with a congenital heart problem. It's been with us all our life. And since 1 out of every 100 people born in the United States have this problem, any one of your friends or relatives can have it next week, and not know that they're the 1 in 100 that have it. So this is important to get out there and talk about it, and help us get the word out. So, you asked a very difficult question. What do we do about it? And I can only think about what I think I can do about it, and that's what I've been trying to do.
Yeah,
But
the very definition of grassroots is just it's
yeah,
starting with who you know and having them tell who they know.
right,
Yeah.
right.
Or,
Well,
or,
it's like the
or you
roots
can
of
make, or you can make a podcast and, make people tell their stories because you're tired of telling your own.
yeah, right, right. Well, yeah, I think if people watch this, they can see through you and me that although we have a congenital heart condition, we've been able to live our lives with it, do important things, affect other people's lives, help other people who need to find a pathway like we have to deal with their situation. Um, and if we can accomplish all that, we're doing important things. Um, so I thank you for doing this podcast, and certainly thank you for inviting me to participate. And I think we are doing important things.
I'd really like to think so. And I thank you for the kind words. And I know that we're coming up on time, but there's a few things I want to ask you before I get to my big closing question. But you touched on this previously in a way of how the title of longest lived open heart patient took you to advocacy. But taking that a step further, and this is going to touch on the million cool things you've done in your life that we didn't even talk to, like helping with legislation post Watergate and all your other very impressive. We talked about publishing the book, but just everything else you've done. When you think about legacy now, and you think about professionally and personally and on the cardiac side, with that title of longest lived open heart patient, where do you see your legacy? Where do you see your fingerprints on other people's lives? I mean, as someone who's had a finger in your heart, what other hearts have you put your fingerprints on?
Wow, that's a big question. I guess the answer is I just hope that I've been able to make a difference in people's lives in many different ways. And it starts, of course, with CHD and what we do with ACHA. And I hope that what I can say and tell people who have CHD will help them get through, their situation, their individual situation with CHD. But I think of it, you ask about legacy. Legacy isn't just one avenue. I'd like to think that all the students I've had in school, at law school, that at some point they'll say, "Oh, I remember that professor, 20 years ago. He was really pretty good. I learned a lot from him." I've had students come up to me who had me 20 years ago to say that. Um, I like to think that the people I give tours to at the Air and Space Museum say, "Hey, that was really a great tour. I learned a lot. And thank you for doing that." Um, so, I mean, we can have our legacy in many different, buckets. And it's not only the CHD bucket, but there is in just in any way impacting the lives of others. I'll just give you a very short, quick story of what I'm talking about. Just this morning, my great nephew contacted me, and he's applying to colleges, and he sent me his resume, and he said, "Uncle Bill," he says, "I'd like to have you take a look at this. I want you to review it before I send it out because I think I appreciate and respect your opinion." What more can you ask about for legacy than something like that? Um, so I scribbled up his resume and put lots of marks on it and sent it back to him and had a quick conversation with him earlier. And so I think that's a life I affected today, and that's what your legacy should be all about. That's
Making
probably a, that's probably a simple, too simple an answer to a very important question, but
it's not a simple answer, but you made it simple to understand because I'm with you. I really am. I mean, I say for this podcast. I mean, this doing this, the social media, the website, the publishing, the post production, as somebody who has not a single creative bone in their body, it's a lot of work. But I always say, if it can help one person just a little bit, it's worth it. If it can help one patient, if it can broaden the universe a little bit, if it gives one person one good resource, it's all worth it. And I think you're taking that a step further where legacy isn't about some it's not about some big arc you build to yourself and all you've accomplished. It's not about the fact that some people know your name. What legacy is, it's the little nudges you make throughout your life that make it better for everyone else. It's holding the door open for someone is just as important as giving away your entire net worth to an organization. In a lot of ways, it's binary.
right.
If you can help, you help, and that's what it comes back to.
You have a, a a good step up or legacy when you have a student you had 20 years ago say to you, "I really remember your class, and I think I learned a lot in your class." That's what you want to hear.
And it's probably the kind of effect that you don't even think about at the time. It's just from what
Right,
you're already doing.
right.
And tying it all together, and I'm thinking about how to say this as I say it, so I might speak over myself. But I think this all ties back to the legacy all ties back to the legacy of Blalock, Thompson, and Taussig, where if they hadn't done what they've done, I mean, another reason why I just love to talk to you is because of everything you've accomplished and the lives you've affected because of what they've accomplished. And the best part is, there's a lot of CHD patients like you that are just at different spots in their life, still making that influence. And none of it would have been possible without these doctors and caregivers and researchers that did all this work long before I was even born. And it ties back to the awareness issue where people don't even know they have congenital heart defects. So there's this universe out there of patients that are surviving and thriving who aren't aware or not involved in the community, making these dramatic differences as they live normal lives. And that's the takeaway I want everyone to get from this episode or series of episodes with you
You
is
know, it, when you talk about legacy, um, I come back to the letter I got from Dr. Taussig when she got my letter and she said, "Hearing from you warmed my heart." That means a lot to me. And you're right. The Taussig and Blaylock and Thomas collectively and in their individual ways had such an influence on the medical world in general and the cardiology world in particular. Um, And I feel very fortunate that they all crossed their paths at one moment in their lives, and I was there with them when it happened. And so if you want to talk about legacy, I think about those things a lot.
The legacy of CHD care and the legacy of CHD patients.
Yeah.
And the little nudges on a million different people making a million different nudges on a million different lives. And that's why awareness is so important.
Absolutely.
Because it's already happened. All this is already happening in the background. It's just making sure people are aware of it so that the patients that need care know where to find the ACHA and that the ACHA can keep trucking. It has been an absolute pleasure talking to you. And
well, I enjoyed it very much.
Everything I've wanted and more. But before I let you go, what, I asked you, I mean, we've already really discussed what CHD means to you. And the typical question is, given everything we've discussed and everything you've done, what does CHD mean to you? We touched on it with legacy a bit, but I want to give you a chance to answer that and to mention anything else you want to before we end, including plugging your book again and plugging the ACHA. But you've lived a hell of a life. You've seen a lot, but you've also seen a lot of cardiologists as they grew, and you've seen, you're talking to patients like me now and patients that are younger and going through something completely different at the highest or lowest level. What does CHD mean to you now?
Well, it's been a part of my life since I can remember. My very first memory is the day I was introduced to CHD. And I think I just feel fortunate that I've had the life I've had with CHD, and that I feel very fulfilled by it in many ways. And I just want to be able to help impart that to others, so that they can have the fulfilling life that I feel I've had. Going back to, what my mother said, you're different, but you're not special. You're not unique. You're not different. I just want people who have CHD to get the most out of life, make sure they take care of themselves, they see the right doctors, they go to the right places, they keep involved with the community, and I think life will be fulfilling for people if they do that. And I just hope that happens. I know that's probably not a very good answer, but it's a difficult question.
It really is the perfect answer, because all you want, I think my generation or the generation after calls it living their best life. All you want is CHD patients to have access to the right care and the right resources and the right help when they need it to live their best life. And that is what the ACHA does, the Diabetic Heart Association does, in so many different ways, amongst other organizations like the Cardiac Neurodevelopmental Outcomes Collaborative and the handful of charities for pediatric congenital patients.
Exactly. Right. Well said. Better said than I said it.
I'm just summing up what you said.
Yeah.
Bill, it has been an absolute pleasure talking to you. I'm going to do our close now, and I just want to say thank you.
Well, I want to thank you for giving me the opportunity to talk with you, and to share these thoughts with people. And I hope it helps people as we take that next step, as I talked about.
And that was William Bill Caussy, the longest lived open heart patient who has direct experience with the Blalock-Taussig-Thomas procedure. We hope you've enjoyed this episode, and as always, thank you for your time, and I'll talk to you soon.
Thank you.
And that was part 3, the final episode of this mini-series. Thank you all for listening to all 3 parts, and if this resonated with you, share it with someone who needs to hear it. I'm Dresden, and I will talk to you all soon. Thank you.